Är jag live nu? Amat, är det bara att trycka på den här knappen?
Vad?
I mitten. Jo, nej, det var inte. Jag är live. Jag väntar på Janette. Okej. Hej guys. Jag är inte så van vid det här med live. Vi ska se hur det går. Jag tror att Janette kommer komma här när som helst. Där är något godkänt. Hörs vi? Hörs jag? Ska se om jag godkänner. Någon annan som vill vara med också. Hi!
Hi, Asabia. How are you?
Hi, Janette. Oh, now I can hear you. Great. I worked it out. Sorry, I'm new to the whole live thing.
Here we are together across the world.
Wonderful. Amazing.
Oh my gosh, I love seeing everybody writing in here. This is fantastic. Hello, everybody. Hello, everybody.
Hi, everyone. How are you?
I'm well. Today has been a fantastic day. We're well into C Summit. And for anybody who has not heard of C Summit, this is my way of celebrating Cesarean Awareness Month. And I've been running a whole month so far of workshops. And
You've been doing a lot.
A lot. Asabia, a lot, and I love it. It's almost like it's free training for me, let's just say, because I get to speak to so many experts. And also, it's fantastic to be running workshops and serving so many moms like this across the world. I think it's just amazing.
It is amazing. I'm so happy to talk to you today. We've been getting so many questions, so I guess we need to get going. I just want to say something before we start. Jag antar nu att de flesta som kollar pratar svenska och att ni förstår engelska. Men vi kommer köra det här på svenska så att det inte ska bli allt för hattigt. Men om det är någon som tycker någonting är oklart så skriv i kommentarerna eller skriv till mig senare i DM så ska jag försöka förklara. Okay. That's all.
Oh my gosh. Okay, so before we begin, Asabia, I actually want to know about your people who are here attending this live, because it is, although you did so much of the hard work asking everybody the questions and sending me all the questions, I think it's fantastic. I want to know about the people here who has had a cesarean in the last 6 months. Just put in the comments me or, you know, a bunch of hands. Yeah, because I think it's also very important, you know, when I answer the questions that I am catering to the people who are listening in today, right now. I know you'd also mentioned, Asabia, that you'll be saving this later on in your life for people to be able to view. But I'm
going to try anyway. I've never done it before, but hopefully I'll work it out.
This is your first time?
No, I've done it like once before, ages ago, but I'll try. Yeah.
This is amazing. Yeah, all it'll say is ask you, do you want to save this? And you click yes.
Okay, I'm going to manage.
And that is all. So I'm seeing a lot of
a lot of me. Yeah.
Yeah, so many. One so recently. Oh my gosh, 9 months ago. Yes, so many cesareans coming in. Fantastic. And moms, as you are responding, I also want to acknowledge that it's incredible. Everyone here seems to speak 2 languages at least. I think that's amazing. Asabia and I were talking prior to this Instagram live whether or not we'd be doing translation. So we will be talking today in English for this particular interview. And Asabia, I think you did mention that you may answer questions later on in Swedish.
Yeah, that's what I said in Swedish.
That's what you said in Swedish?
Yeah. So if they have,
I understand.
It's unclear, they can write me later.
So Asabia, you wrote in so many fantastic questions here. Okay, we even have moms, writing in 7 months ago, 3 years ago, having cesareans. Okay, this is important because what I do as a perinatal athletic therapist, I'm in Toronto, by the way, Toronto, Canada. So
yeah, tell us
everybody.
what does that mean? The perinatal athletic therapist, I think that's a new title for a lot of Swedish people and for me as well. So.
Yes. So a perinatal therapist is someone who works with moms while they are pregnant and or postpartum. So for me, I am a perinatal athletic therapist because athletic therapy is my background training. So I just put the term perinatal in front because I wanted people to understand that my 20 years of training is specifically with the active population. So what that means, what I do is I work with active moms while they're pregnant to stay active and injury-free, to be confident and strong in their bodies, but then also right after childbirth to help them rehabilitate after, well, let's call it what it is. It's an injury. Childbirth requires rehabilitation, right? So I take that mom and I help them recover from childbirth, whether it's vaginal or cesarean birth, back into their sport. And their sport can be active, healthy living with their families. But I also work with, competitive athletes of lots of different sports, all the way to elite athletes. So okay. I see someone writing in here, needed you when I was pregnant 4 years ago. Well, we're here together now. So I'm so glad that you were listening. And to moms who write in and say that, I hear that so often, I always inspire you to pay it forward. And that means anything you learned today, tell all the moms that you know, all the women who are not even pregnant yet. The idea is women's health here in North America anyways, is just such a gap. There's not enough information for women when they're pregnant of what they can do in terms of activity, what's safe, what's not, and then postpartum, especially after cesarean Asabia. People are literally like, what do I do? My doctor just said I'm discharged, but I'm not strong and I'm in pain and I'm scared to move my body. So I always say, pay it forward. Anything and everything you learned today, tell as many women as you can, because it truly takes a village of women to raise mothers.
Yes. Agreed.
So, yes.
So we decided, so I got a lot of questions for you. I sent you many emails, but we decided on maybe focusing on scar tissue massage today, right? And then we'll see what we get into.
Yes.
Is that the plan?
Oh, for sure. So just a quick view of hands and maybe even hearts. How many people have heard of scar massage before? Scar massage for cesarean recovery. Who's heard of that? And if you haven't heard of it, maybe in the comment, just write, not me, because I think that's more important too. I mean, if you've heard about scar massage, that's great. But the majority of people have never heard of scar massage and don't know that that's something they can do themselves to really improve their recovery. So Karen Nula is saying yes. We have someone saying yes. Look at all these yeses and all these hearts saying me. Oh, Anna's here.
Yes.
Anna.
It's Anna who told me about you.
Oh my gosh. Anna and I were just chatting earlier today. So it's so great. It's so great. Marie saying not me. Okay. So we definitely have both camps. So let me describe what scar massage is in the first place.
Please do.
People are like, okay, what is scar massage? I'm hearing about it for the first time. What is it? Is it too late for me? How do I do it? All those things. So scar massage helps scar tissue, as the scar tissue is being formed, to be more stretchy and less sticky to the things around it. That's just the layman's explanation for it. So basically it's improving elasticity and decreasing adhesions. Now, why does one want to have that happen? Don't we want to have scar tissue to make sure things don't open up? Now, here's the thing. Scar tissue is your body's own super glue. It's such an incredible material that it basically never gets ripped open again. The thing about scar tissue, though, is that if it sticks too much to things around it, if it heals too tight, it can cause chronic pain and chronic dysfunction. Chronic meaning months, years, even a lifetime. So some of us talk to our moms and our moms go, oh yeah, I had a cesarean when I had you. And it's, I still have back pain. I still have pain during sex. I still have, all these kinds of things. And then we, as the daughters, go, oh my God, I don't want that to happen to me. So here's the thing. Scar massage is something that you can do by yourself on yourself. It's actually not complicated. So I really want to talk about that today. The other thing is there is a really sweet spot window for when scar massage is most impactful. Meaning if you're 0 to 6 months postpartum, post-cesarean, this is a really, really great time to start your scar massage because your scar tissue is still what we call remodeling. It's still being made. So you can actually change how stretchy it is, and you can change how much it sticks to things around it. After that 6-month mark, that it's not like you can't make changes. However, it's tougher to do it on your own. Okay. Yeah. So that's why we really want, Asabia wanted me here on today, because there were so many questions coming about, well, you know, I have this pain after cesarean. What should I do? Or I've heard about scar massage and I tried it, but it actually caused more pain. Or I still have bleeding. Like, when do I start? So, you know, I looked through all the questions that you sent me, Asabia. Mm-hmm. What would be the best? Let me say, I was too scared to touch my cesarean. You know what? Can we start with that? Or what do you think?
Sure. Let's start with that.
Okay. And I love that this question was put in, Sweet Honey Sunshine, because even though I'm a perinatal therapist, so therefore I talk about physical rehabilitation, truly the first step with a physical rehabilitation is rehabilitating in here. What was your birth experience? Do you have fear, shame, or sadness around your birth experience? Because if you do, the thought of touching your own scar can itself cause more pain, or it might make you feel so queasy, or you're just scared and you're like, I can't do it. And I want to say that is so common, and I want to acknowledge, if this is you, that you are not alone. And that is, in fact, the first step to healing. Okay. Now, today, because we really wanted to talk about scar massage, maybe we can address the mental health healing another time. And or for those of you who do seek a few more pieces of information, hop on over to my Instagram, because I had tons of expert interviews about that very topic all last week. There were 4 interviews actually. Okay. So hop over to that and learn there. So let's say you're in, let me just see. Sorry if I understood, when scar, how can scar tissue, oh, you know what? This is a very good question. How come scar tissue in the uterus can rip when scar tissue in the skin can't? You know what? It can't. So Marta Carls, that's a very, I think Marta's asking because she's heard that the concept of a VBAC, or vaginal birth after cesarean, may be dangerous because it might tear the scar open again on the uterus, right? I think that's why people are asking. Yes, I'm seeing some hearts. Okay. Now, one thing I want to explain about scar tissue is that it is stronger than any other tissue in your entire body. So a physician had explained to me, when we get pregnant after a cesarean, it's not the incision that tears, it's the tissue around it that is more at risk. So a great way of thinking about it is, Asabia, I don't know if you've ever done this trick before, but back before I had kids and I used to wear pantyhose, you know how you'd get a tear on your pantyhose and you would put a little bit of clear nail polish on it? So did you ever do that?
Yeah, I did do that.
Okay. Good. So it's just not a Toronto thing. All right. So when you put that clear nail polish on your pantyhose, what happens? Everything around the pantyhose stretches except for where the clear nail polish is. Mm-hmm. It actually is so not stretchy that everything around it almost has to stretch more, so you can put the darn thing on and pull it past the point where the clear nail polish is. That's the same analogy for the scars, the scar tissue.
That's a great explanation.
Right? Yeah. So that makes sense, right? So if it's going to tear someone in your pantyhose, it's not going to tear where the clear nail polish is. It'll tear where the pantyhose has to stretch extra to accommodate for the clear nail polish. So to Marta, who wrote in, that is why the doctors are saying there should be a period of time to rest or recover and heal from a first cesarean before we attempt a second pregnancy. It's not because you're not strong. It's because we just want to ensure that the tissues legit have had a chance, the non-incised tissue has a chance to heal enough so that it can attempt that stretch again once we become pregnant. Martina, I'm sorry, that's exactly what I mean. Oh my God, thank you so much. Okay, good.
There's another question there from Hey Mariam. asking if you can do this with the vaginal scars as well.
Yes. Oh my gosh. Yes.
The perineal massage. Yeah.
Yes, you can. So the perineal massage, for anyone who's had a vaginal birth here. So I've had 2 vaginal births. Asabia, you have children, yes?
Yeah, 2 vaginal births.
2 vaginal births yourself. So you may have torn. I tore a little bit the first time around. The whole idea of touching yourself in a place where you have to rub because you know that it's been torn, that's not easy to do. So I really need to acknowledge that for everybody. Like, please, it's okay if it's taking your time. Now, yes, scar massage is impactful for any scar in your body. Any scar. The thing that's different about vaginal tears is that it's highly vascularized, which means there's so much blood flow in that area. It heals very well in comparison to, let's say, on our bodies, where, you know, in the abdominal region, this is skin. So skin is not as highly vascularized as, let's say, your vaginal tissues. It's like biting your tongue and it heals within a day. It's different in other parts of our bodies that aren't as vascularized. Okay, so yes, it can help. Now, scar massage. Okay, I think there were so many questions coming in here.
Like, where does one start? You said 0 to 6 months. So is it like day 1, or should one wait? When does one start, and what technique should one start with?
Amazing question. Okay, so I actually want to do a quiz here. I'm going to ask everybody here, how soon do you think scar massage can begin? Do you think it's day 1 right after you come out of the hospital? Do you think maybe it's around week 6 where your doctor has discharged you? In Sweden, Asabia, it's week 6 that you would have a checkup with your doctor. Is that right?
Usually you don't have a checkup with the doctor. You see a midwife after about 6 to 8 weeks.
Yeah. Midwife?
Yes.
So everyone who gives birth has a midwife?
Yeah, it's midwifery led kind of. Yeah, if you have, yeah. But you correct me if I'm wrong, you guys who've had a cesarean, but you usually don't see a doctor afterwards if there's no complication. Our postpartum care isn't it's not a lot, if I put it that way.
It's not a lot, but I think midwives are fantastic. The midwife comes to you, though.
It's a very short session, about like 6 to 8 weeks after birth, and I feel like there's a gap there. It happens a lot during those 6 weeks. I would have liked it to be something more in that time, but yeah, okay. No doctor.
Maggie, yes, everybody says just a midwife 8 weeks after. Okay, so interesting. And I'm seeing answers about when one thinks that scar massage begins. And okay, so here in North America, when I pull my North American clients, how it works in North America is we have a 6-week checkup with our doctors. So if you've had a cesarean, and cesarean, you always have a surgeon, so you check up with your surgeon. If you had a vaginal birth, you would have either a midwife or a obstetrician. I had obstetrician my first birth and midwife second time, and you would have a checkup at the 6-week mark. So the answer here, when do you start scar massage? A lot of you got the answer. It's right away. It's right away. Now, I want to say that there are two main different types of scar massage. Direct scar massage and indirect scar massage. So what that means, direct scar massage is if the scar is here, that I am actually using my hand directly on the scar and massaging it. Indirect scar massage is creating movement in the surgical area without me touching it. Okay, so in this case, I could do this, I could bend my elbow, I can move my wrist, I could turn my, right? So I'm moving the forearm. So the answer is right away for indirect scar massage. And I saw some people write in earlier on, like, where are you in your postpartum journey? Some people said, oh, I'm just a few weeks. So that's very exciting. So what I'm about to describe, this is for you. If you're from 0 to 6 weeks, what you don't want to do is, so I'm going to actually do this. I'm going to draw an incision on my belly. If this is your external incision, in the first 6 weeks, what you're not going to do is hands on your belly and doing some kind of mobilization, even gentle stuff, right? We're not interested in disturbing that scar from healing. We really want to make sure that scar tissue heals shut. As a matter of fact, I want to describe. Somebody said, well, what about the incision on my uterus? Well, so we know that there's an external incision. Like, did you know after that skin and the fat, there's actually a second incision right down the linea alba, which then is pulled open. That's how your muscles are pulled open during surgery. And then your uterus is there. And then another incision is made through the entire uterus. So there's actually 3 incisions during the surgery, during your cesarean birth. So when we're talking about scar massage, we're not just talking about the outside scar. There's 3 scars to think about, okay? Now, in the first 6 weeks, we don't move that scar with our hands. Indirect scar massage. Hang on a second. Should more information about you're really by yourself and so. Okay. Josephine, I just want to say you're not alone. It can be so frustrating, the feeling of being just, you need help, you want the help, but you don't know who to ask.
Yeah.
So I acknowledge that. And I'm just so glad you're here. And this is social media. Now we use Asabia and I use it for good. We're here to just spread important information that should be accessible and free to everyone around the world. That's why we're here together tonight. So let's talk about indirect scar massage. Yeah. If this is your belly area and you want to move the belly without using your hands, how can we do that? An easy way is this. Belly breathing.
Of course.
Belly breathing. So this, everybody breathes, yeah? So I always say, okay, is scar massage safe? Now, is it safe to breathe? Yes, it's safe to breathe. But to be even more specific, how do I know that I'm not hurting myself? Because everybody is different. The answer is this. 2 things you always want to ask yourself. If you're like, I don't know if this is safe for me, Asabia, can I do this? Ask, does it increase my pain? Okay, so what's your pain like? And does it improve my mobility? Meaning, can I move better? Can I move better? For example, in the first 2 weeks, especially the first 2 weeks after surgery, we're almost bent over, it hurts so much. If we do belly breaths, does it allow us to sit up straighter, right? That's an example of, does it improve my mobility? Okay? And then from a side view, all I'm doing is this. Breathing in, which is just relaxing my belly. And then when I exhale, and you can see.
How many times should one be doing this?
Oh my goodness. Try, literally, if you can, 5 slow breaths in a row. And sometimes people are surprised, oh my gosh, it hurts so much less after only 5 breaths.
Oh, really?
And that's so simple to do. And of course, it takes no extra time outside of your day. If you're holding your baby, let's say you can do it, let's say when you're feeding your baby.
Yeah.
And there's no limitation to how often you can do the belly breathing unless it hurts you more, right? If it increases your pain, and unless it decreases your mobility. Right? Your 2 safety questions. What's your pain? What's your mobility? So if it decreases your pain and it increases your mobility and you're doing 5 breaths in a row, maybe you can do 10 breaths in a row. Maybe you can do it every hour. Maybe you can just do it all the time, because eventually your body wants to breathe into the belly. I mean, Asabia and I are just sitting here, we're just chatting to one another. Technically, our bodies are relaxed and should be choosing to breathe into our bellies, right? So when we're relaxed, we breathe into our bellies. After surgery, moms, I need you to understand, you're not in a relaxation mode. You're in high pain and protection mode. So that belly breathing helps take you down from that protection mode. So it also helps with your nervous system, right? As well as your physical body in healing. Okay?
Okay.
So yeah, that's just one example. There are many more, but I think that's probably a good place to start for so many of us, right? Yes. Any questions about that? Asabia, did you have any questions about that?
I just feel like that's a good thing for even after vaginal birth, you can start with your belly breaths to get that core
oh my gosh,
connection again. But so when does one move on to like the next step, and what is the next step, would you say?
Okay, so the next step. So first step is mentally being comfortable with touching. Yeah. Second step is going to be belly breaths. Actually, belly breaths can come concurrently with mental preparation of touching and looking at your scar. Okay, so the third step, I guess we can say, is scar massage. So what I teach my athletes is this. First, you're discharged by your midwife or your doctor. Okay, that's very important that there's no infection. You don't want to massage something that's infected. This is a big no-no because it'll make the infection worse.
Important. Yes.
Yes. Yes. Yes. So what do we start with? So again, I'm teaching moms how to do this themselves. So it's not fancy stuff, and it doesn't have to be. So can I demonstrate actually in my body?
Of course.
Yeah, so then we can all see this. Can you see me here? I'm just going to lower this a little bit. Oopsies. Yeah, this is how I do it. This is how I do it. So first of all, the body position matters. I'm just demonstrating in a kneeling position so everybody can see. But what's very important is that you want to be in a place where you are comfortable and feel safe. Because that feeling of safety is what's going to allow you to touch the scar without more pain. Yeah? It's very important to feel safe. So lying on your back with your knees bent is ideal. But some of us are like, oh my gosh, if I lie down, I don't think I can get back up. So it's okay if you want to, if you're early on in healing, maybe you want to sit on a nice big comfy chair or comfy couch with your back rested. Okay. Ellie Velb is asking, should belly breathing start week 1 already? Yes. Yes. Belly breathing can start day 1.
Yeah. If it feels okay. If it's not more pain and it increases your mobility.
Exactly. 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 So if it's day 1, week 1, Ellie, you're probably experiencing a lot of pain. So you want to make sure that the belly breathing, and it's small breaths, you don't have to take deep breaths, that it's helping your pain. Okay. That's when you know it's appropriate. Okay. So now you're at 6 weeks. Your pain is generally, manageable. You have no infection. So what's the first thing you do? So in a comfortable position, the first thing I coach my athletes to do is this. Can you touch the skin around it with your hands? Some of us have already started this even weeks before. Some people are like, I'm curious. They're in the showers and they're bathing and they just want to know. That's okay.
When you say pain-free, or what are we looking for here?
Yes, great question. So when I coach my athletes, I say use a pain scale from 0 to 10. 10 being excruciating pain, 0 meaning nothing. So when you're touching, it should be 0 out of 10 pain.
Okay.
Because this answers some of the questions that were being written in Asabia. It's like, it's numb and painful at the same time.
Yeah.
Is it safe to touch it? Right? Yes, it's safe to touch it. It's numb because literally all these nerves have been cut during the surgery and they're trying to grow back. And as the weeks and months go by, it'll start to feel almost tingly. Do you know what I mean? Some of the moms here are like, yeah, I know what you mean. It hurts and it's numb at the same time. It's tingly, little electrical shocks maybe, right? So over the weeks and the months, that indicates the nerves are growing back. It's a good thing. It's good. It's fine. Okay. So if you're touching gently, it should definitely not increase any pain. If at all, it'll feel like, oh, it's okay. Oh, nothing's happening. I'm not hurting myself. Oh, look, it's just fine. And then your belly might relax, right? And then that's good. So I'm touching directly on, but the first time you do scar massage, you don't have to touch it directly on at all. Now, let's talk about one of the techniques. So when I teach the different massage techniques in my programs, I start very gentle and I take that same technique and I progress it through the 6 months. So why don't I take one technique and progress it through the 6 months? I can show it out to all of you.
Yes.
Yeah. Good. There are a few massage techniques to remember, but this is just cover one. So we all can learn something here today that we can use. So the first one I talk about is called pull and hold. So notice where my hand is. It's so far away from the incision. I'm nowhere near the incision, but friends, when I take the skin above my belly button and I pull it, look what happens to the scar. You see how it pulls up?
Mm-hmm.
So by pulling up here, I'm actually massaging down here. I'm creating movement down here. Now the hold part is important because that's going to tell me, okay, it can my skin move? Because it should be able to move, right? Is it still 0 out of 10 pain? The answer should be yes. Is it increasing mobility? Now the mobility isn't necessarily body mobility, it's skin mobility, right? So for the first time, if anyone's doing this right now, and you're past the 6-week mark, so generally this is probably safe for you. When you're pulling, you might be like, oh my goodness, I didn't know how stuck it was. I'm trying to pull, but it's actually stuck here, right? Yeah, I see some hearts. People are like, yeah, oh my goodness, that's me. I didn't even know. So here's the next question, Asabia. People are writing in and saying, how do I know how hard to pull? It's numb. I can't feel it.
Yeah.
Right? So again, we go back to the 2 rules. The way I teach it is this. What's your pain? What's your mobility? You can only, therefore, if you can't feel the pain, you have to test the mobility. Okay? So here, okay, if we look at the tissue above your belly button where there's no incision, that's where we test what our normal skin is like. I don't like to use the word normal because normal is basically what is normal movement for you is different for everybody. Okay, so you're testing your own skin to your own skin. So look, this is how much my skin can move if I really pull it. Okay, don't worry about what's happening down here. It moves like this, it moves like this, it moves in all directions. So I want you all to just try this on your own bellies, way above your belly button, to know what this down here should be moving like. Okay, so if you know, okay, with no effort at all, I can make the skin glide up here, then that's what you want this to get to. Okay. It won't happen in one day. It won't happen in 1 week. But that's the idea of, hey, I'm pulling it. I see it moving. I need it to eventually move like this. It's pain-free. I can hold it for 5 belly breaths.
Okay, so that's how long you should be doing it for.
Yeah. Well, I mean, as a teaching someone to be their own therapist, yes, that's what I would recommend.
Okay.
Now, if I was working with a client as their therapist and I'm treating them with my hands, this technique can take minutes. It can take 10, 15, 20 minutes. But you as the layperson, you don't know what to look for. So yes, on your own, 5 breaths. 5 breaths.
Okay, so that technique you can use from about 6 weeks until 6 months postpartum and increase it increase it as much as you can and to increase the mobility. Is that correct?
Yes. And by the way, the mobility comes back within weeks. So this technique isn't something you do for months and months at all. It actually, the mobility comes back pretty quickly. I mean, for those of you who've done scar massage before, I know some moms here were saying, yes, I've tried scar massage. You know, I've done it myself. Just tell us quickly in the comments, right? It started moving pretty quickly, didn't it? Like maybe even weeks. Yes, we got some hearts. So it's not like you do this technique, this very gentle technique up until month 6. Remember, you have 6 months to make a change in all of these incisions. So I drew 3 big incisions on myself. So the first technique is superficial and far away from the incision. I'm not touching the incision, but of course we want to get closer and closer and closer. How do we know when to start moving closer? Well, it depends on you. How is your pain? And what's your mobility, right? So we go back to the first rule. If I know my belly skin is supposed to move like this, and I start day 1 and it's like, oh, it's stuck. But then by day 2, day 3, day 4, it's like, oh my goodness, not only can it move more, it doesn't actually hurt. Like I can do it. It doesn't hurt, right? So then you can get closer to the incision. And maybe on the incision, right? And maybe you feel safer just doing the edges and not right in the middle. And maybe you feel safer using your whole hand instead of one little finger. Maybe you feel safer pulling up instead of pulling down. But the technique is the same. 5 belly breaths. Hold it for 5 belly breaths. No pain, right? And increasing mobility. So every body is different. Janette, do I pull it up, sideways, or down? It depends. Where do you not have mobility? Every body is different. You may have had an infection on the left side and not the right. Maybe your scar is tighter on that one side because that's where the doctor might have, stitched a tight stitch. Sometimes people report that, right? So you might have to do more work on one side versus the other. Does that make sense, Asabia, or am I moving too fast?
I'm just looking at the time. Time really passed by really quickly. But
I know.
I just have 2 quick questions because you kind of answered this before, but just to be clear, there were a lot of people writing in that maybe they're like a year and a half or longer postpartum and they have problems with a stiff scar. So what can they do if they need help with that? Okay, so the best thing to do is connect with a perinatal therapist like myself. I'm sure there are therapists in Sweden you can connect with. Yeah. So many therapists are virtual as well. The reason why you want to connect with someone one-on-one is because every body is so different. You may have a stiff scar because you're not moving right, not because the scar is stiff. Or maybe you have a stiff scar because the scar is stiff. Do you see what I mean? So the solution then would be completely different. Yeah. So the best option is to connect with somebody one-on-one. Okay. If that is not possible, right, and you've never done scar massage before, even if it's years out, I would say start with scar massage. It doesn't hurt to try, right? It can't be. Could it be a bad idea to start scar massage too late? I mean, can it hurt more than it helps? Only if it causes more pain and if it causes dysfunction. So back to the same 2 rules. Is it causing me more pain? And can I, maybe I can't even move after that, right? Then yes, then that wasn't a good idea. Yeah. Heard you can also feather tickle the scar skin around it. What do you think about that? Melina, yes. That's what we call desensitization massage, meaning you're trying to get your skin to feel comfortable receiving touch, right? Whether it's touch with your hand, touch with a feather, touch with I talk about using a fork even because the skin is designed to feel sharp versus dull. So you can use your fingernails versus, let's say, the pads of your finger. The skin is designed to determine between those 2 things. So as your nerves grow back, it's kind of good. Anna Keir says, I did Janette's course. It's an investment for your entire lifetime. She tells you what is going with the body and what to do with scar massage wise. Oh, Anna, thank you so much. Thank you. How if one wants to do that course, where to look? So you can hop over to my Instagram, Ask Janette. And quite frankly, I would say don't even do the course first. Come to C Summit. That's C Summit course, right? I beg your pardon? That's a free resource. Anyone can do that, right? Yeah. Well, C Summit is the event that's going on right now for the whole month. Yes. So it's a free event where there's free workshops, and free expert interviews. That's free. Just sign up for that to start. Yes, because you're going to learn so much there. So you can ask better questions and determine, am I going to be someone who will learn well from an online course? Because not everybody does. Let's just be honest. Just because I think it's an incredible course doesn't mean it's the best thing for everybody. And I acknowledge that. Yeah. So that being said, if you wanted to look more into the courses, that's also on my Instagram, Ask Janette. It's all on my Linktree profile. And all the courses for the entire month are 20% off. Okay. So that's something to look into. I feel, I have 20 more questions, but maybe we should do another live at another time because now we're already 40 minutes. I think we should. Asabia, you know what I'm going to do? I'm going to put as a little question sticker on my stories. So friends, if you want to hop over to Instagram and write in your question, and I do apologize. I know some of us here don't speak English fluently and you're speaking Swedish, and I do apologize I'm not able to answer your questions that way. However, let me at least populate some of those questions so I can answer them over the next 24 hours. And Asabia, we can do this again. Yeah, let's do it again. Yeah. I feel like. I'd love to do this again. Even though it went by quickly, I feel like we learned a lot. Oh, fantastic. Thank you so much for having me on. And to all of Sweden, I'm just so glad to be here. Yeah.
I'm so glad. Thank you for having me.
We'll definitely do this again, Janette. Thank you so much.
No problems at all. Take care, everybody, and have a great night.
Hoppas ni fick med något. Okay. Great seeing you. Bye-bye, everyone.